Okay. So first I'll check the order for the patient and check for allergies. Um, then I'll assess my patient. I will wash my hands before and after patient care. I'll introduce myself to the patient and identify them using two identifiers. Um, I'll provide for privacy, and then I will explain the procedures. I'll educate my patients, and then afterwards I'll evaluate. So this is my newborn assessment, and first I'm going to check my patient's vital signs, and since this is a baby, we're just going to do temperature, heart rate, and respiratory. We don't normally check blood pressures on infants. So I would check the chest circumference, and I would use like a paper tape measure to do this. I don't have one, so I'm not actually going to do it, but it should be around 13 inches. His head circumference should be about 13 inches too, and then the abdomen should be about 14, so you would measure all three of those and document that. I would check for reflexes, so the startle reflex is like a slight drop. You don't really take your hands off the baby, you just lower them down, and then they should like throw their arms up. That will disappear at around 6 months. The rooting reflex, that's where you would like rub the baby's cheek or tap it, and then they would like turn their head towards where you rub it, and then the grasp reflex is where you would put your finger inside the baby's hand, and then they would wrap their hand around your finger, and that'll disappear around 4 to 6 months. So the baby has pink mucous membranes and nail beds. If they have like bluish hands and feet for the first 24 to 48 hours or so, then that's normal. I would assess the skin turgor on either the thigh or the chest, and that would determine the hydration status. The hands, the palms of the hands and soles of the feet should have wrinkles, and I would report any cyanosis, any meconium staining, poor skin turgor, pallor, and I would check and see if he had any like moles, and I would report any moles found on the baby. So I will palpate the suture lines and the fontanelles on the head. I would use a pen light and assess their pupils, and the pupils should be equal, round, reactive to light, and they should accommodate. I would inspect the eyes for symmetry and make sure there's no draining. I will inspect the ears for symmetry and make sure that, and see if there's a straight line from the inner canthus of the eyes to the ear. If the ears are lower than that, that can indicate like fetal alcohol syndrome. I would use gloves, and then I would palpate the baby's palate and note for a sucking reflex. I would observe the baby's breathing pattern and assess for chest symmetry. For the respiratory, and then I would do their check his capillary refill, and to do that I would hold my finger or press down on the baby's foot for about 5 seconds and then release, and the baby's capillary refill should be less than 30 seconds. To do his lung sounds, I would use a pediatric stethoscope to listen, and then crackles are usually heard in the baby's lungs in the first 24 hours just from being submerged in fluid for so long, but after that the crackles should go away. So his abdomen should be domed, like dome shaped. The umbilical, I would inspect the umbilical stump, and it should have it should be white, and it should have two arteries and one vein. There shouldn't be any bulging around the umbilical site. I would listen to the baby's bowel sounds, and bowel sounds should be present 1 to 2 hours after birth. And I would palpate the abdomen. So then for the circumcision, I would check and see how much blood there was, if there was any. I would educate the mother about using the petroleum jelly gauze so that it doesn't stick to the baby's diaper and damage anything. I would let her know that any yellow crust is not a sign of infection and not to pick off any crusty things that she might see. I would tell her to keep it clean and dry and to continue to give him a sponge bath until the circumcision has healed. So I would tell her to call her healthcare provider if the baby's penis became discolored, if there was any discharge or pus coming from the penis or the surgical site. I would tell her to call the healthcare provider if she saw blood in the diaper bigger than 2 inches, if the baby isn't urinating, if the baby has a fever of 37.8 degrees Celsius, I think, axillary, and if she is unable to calm or soothe the baby, then I would also tell her to report that to her doctor. So the newborn should urinate within the first 24 hours. I would document and report any decrease in output. I would note the color of the urine, the amount, and if there's any odor. I would change the baby's diaper if it needed it, and then I would inspect the baby's stool for the color and the amount. The first stool is going to be meconium, and that should happen in the first 24 hours. It'll be really dark and sticky, and then for the next 2 or 3 days, the baby will be having transitional stool, and it's like greenish yellow, and it's like a seedy appearance. I would look at the baby's back. I would check for any curvatures or asymmetry. I would look for any dimples or skin tags or anything like that on the midline of the back. Because if they're along the spine, then that's not normal, and it can indicate problems. So then I would inspect the extremities. I would make sure, or I would check the baby's movement, make sure they can move their arms and their legs, and I would make sure that they were all the same length and all that, and then I would inspect the baby's ID band, which this one doesn't have one, but if we were in a hospital and this was a real baby, it would. I would make sure that the ID band wasn't too tight, and then make sure that it's there and that it matches the mother's, and then I would report any abnormal findings and document everything.